So I have a daughter, her name is Remi. She is 7 years old. And at the time she was 6, and Remi, in the 6 years that she was alive, had never slept through the night before. So she would usually get up sometime between 11 p.m. and 1 a.m., and she would come find a parent, and a parent would kind of have to go and settle her down before she went back to sleep. So we were talking to Dr. Lee, and he was asking some questions. I actually started talking to him because she also was grinding her teeth. And so I was asking him if she should have a mouth guard or what you do for kids when they grind their teeth. And Dr. Lee said, oh, kids should not be grinding their teeth. Does she snore? And I said, yes, she also snores. And then he asked, does she still wet the bed? And I said, yes, sometimes she still wets the bed. And he said, I think what Remi has is actually sleep apnea. So he recommended that I come into Alexandra Park Dental and that we get an assessment done for her. So that's how I found out about the Vivos treatment. I didn't know about it before. Mm-hmm. So we went in and we did a sleep study. So she wore a ring on her finger for a couple nights, and they tracked her sleep. And he said that she had, mild to moderate sleep apnea, and he recommended that we get this Vivos appliance to try with her. But to be honest, the thing that made me the most comfortable is Dr. Lee has a son who also had the same problem. And so he showed us, we actually know his son, our kids are friends. So he showed us the appliance and had his son wear it. And he said that it has been really effective in working for his son. And so I know that Dr. Lee is a very good dentist. So I believed that it would I hoped that it would work for Remi. But I knew that he was a good dentist that would be able to figure that out one way or the other. Yes, so my daughter Remi is a very sensory kid. So he showed me the mouth guard, and I thought there was no way that Remi would ever keep that in her mouth all night long. So when he first gave it to us and wanted us to try it, he reassured me a lot that it was very normal for kids. It might take a couple weeks, maybe a month, for kids to actually get used to wearing that in their mouth. So he said you can expect that she will kind of subconsciously spit it out during the night, and you will have to kind of fish for it and put it back. But he reassured me that that was a really normal thing for kids. So actually for Remi, the first night that she wore it, she said it was really uncomfortable. And there's a little flap on it that holds your tongue down, and she found that flap was especially very uncomfortable for her. So the first night she actually wore it upside down, and then the second night she, without complaining at all, had it on the right way, and she kept it in her mouth the whole night, and she slept through the night for the first time in her life that second night.
Wow.
Which I thought was pretty amazing. No, we are a heavily bribing family. Dr. Lee's office gave us sticker charts, and some stickers. So Remi is very sticker motivated, and she every night would get to put a sticker on when she wore her appliance the whole night. And then after, I think there was a month's worth of stickers. So after she had worn it for a month, we took her and got her a toy.
But now it's more of it's like an automatic thing for
now
her.
It is an automatic thing. Yes, when she goes to bed at night now, she is the one that reminds us that her appliance is not in her mouth. There is absolutely no complaints with her wearing it every night now. So Remi has been wearing this for about 3 months now. And she does not complain about it at all. It is a really easy thing for her to do now. And as parents, we now have a daughter who is sleeping through the night. So for the first 6 years, she had not slept at all through the night. So now everybody in our house is getting a better sleep because Remi is getting a better sleep. So Remi had always struggled with attention and paying attention to things, and at times would seem lethargic because she wasn't getting a great sleep at night. So now that she is sleeping through the night, she definitely has a lot more energy during the day. And she used to wake up in the morning before using the appliance. She would wake up in the morning and was very difficult to get into a good mood in the morning. She often was angry and not cooperative, and it was hard to get her out the door for school. So now she wakes up and is a lot better rested. So she is happy and she is cooperative with the things that we need to do to get out the door. And she seems to just have a lot more energy during the day.
When was that moment for you?
Day 2, when she all of a sudden slept through the night. But we thought for a second it might just be a fluke that she had slept through the night that second night, but it kept going. So I think after a week, I had messaged Dr. Lee and said, "We have a miracle! Remi has slept through the night, and we are all sleeping better in our house now." So I think it was honestly after a week that I was like, this actually works. This is fantastic. Oh, it has impacted us a lot because we now have a really happy daughter in the morning. So I have 2 other kids. She has an older brother and a younger brother. And when Remi is not happy, there is a lot of contention in our home. So because Remi now wakes up happier and has more energy and is in a better mood, it makes all of our day go a lot smoother. It's mostly her mood that has improved. But along with that mood and better sleep, she is a better performer at school. So she is able to sit better and attend and listen a lot better than she could before. So I think it's made her a better student as well. I also think that the routine of it has been a really good thing for Remi, where she is now in a routine of doing something and she knows that that's what's expected of her, and like that's a good lesson for her to learn as well. I would highly recommend this Vivos treatment to any family who has concerns about their kids' sleep. And Dr. Lee was really good about exploring it first without jumping into the treatment. Like we did the sleep study, he called me, we had a discussion, there's graphs, there's, a study that he gives to you. And I think that if there are any concerns that people are having with their kids' sleep, I would say just give it a try. Just even get that study done to investigate it and to figure that out. I also had concerns with Remi having ADHD previously, and had talked to Dr. Lee about that, and he said that this Vivos treatment and kind of figuring out the sleep apnea thing can be one of the keys to dealing with ADHD rather than putting your kids on medication. A lot of the symptoms of ADHD can also be sleep apnea. So I would also recommend, if you have concerns about that, because I did as a parent, that this is a good avenue to explore maybe before looking into that. I was hoping that the sleep would solve all of our attention problems that we have with Remi. And I don't think that it has fully done that, but I think we still do need to pursue kind of an ADHD route for her. But I do think that her sleeping better has really helped her in school just be able to pay attention more. So I think that is still something that we need to pursue with Remi, but I can understand how for a lot of parents, this might be the solution rather than going further down that road. Oh, he's been fantastic. So we had our first, I'll just walk you through it maybe a little bit. So we had a conversation with him about needing to get this figured out. So he recommended that we start with the sleep study. So I contacted his office and I went and picked up the sleep ring. And so she had to wear that sleep ring for, I think, 3 or 4 nights of quality sleep. And we connected it to an iPad, and there's an app that you can use, and it tracks their sleep. So it's very easy, and it's just a tiny little ring, so it's not affecting her sleep at all. And so we had the sleep study done, and then a couple days later, Dr. Lee called me and discussed it with me. And he, explained the benefits of it, kind of talked about the process. And this Vivos appliance treatment is not something that is kind of, we do it for a year and we're done. This mouth guard grows with Remi until she's kind of a teenager. So we will have to keep going back a couple times a year to go get a bigger appliance that's custom fit to her. So we did the sleep study, and then we had this consultation with Dr. Lee. And then we went into his office and he did a really thorough exam of her mouth and her throat and all of that kind of stuff. And then from that point, we got a starter Vivos appliance. So it looks just like a blue mouth guard, really, with a little flap to keep your tongue down. And so that is what she has been wearing. But we have an appointment in 1 more month where we're gonna go back and he is gonna see how the structure of her mouth has changed. And he is going to give her a custom fit appliance, and then kind of moving forward from there, a couple times a year we'll go back, and if she needs a new appliance, she will get one. And and he'll just kind of keep monitoring the way that her mouth is forming.